Good afternoon, everybody. Thank you for the invitation, and I'm going to try to be brief and give everybody a little bit more of time for questions and answers. But my field is in monitoring and evaluation in public health programs, and with MSH we have focused on strengthening health systems for greater health impact. That's our guideline. Wherever we do projects or programs, whether it's in Sub-Saharan Africa, Latin America, or Southeast Asia, or elsewhere, we are trying to focus on strengthening those particular elements of given health systems towards improving health outcomes and hopefully making a positive change in long-term effects and impact, mostly saving lives of vulnerable and disadvantaged population. In the case of the private and public sector, I cannot agree more with my colleagues have expressed in terms of common interest in establishing this type of partnerships towards a common goal, looking at this critical strategy to move forward in achieving whether those are global health goals or local health goals. But as an M&E person, I always try to measure what is it that this particular added value brings into what we usually refer to as a results framework, in which we try to identify very specific levels of results in terms of increasing access to and availability of key services, or increasing the quality of those services within the supply system of a particular health system. Or what is it that this particular strategy is trying to increase the demand for those health services, unfortunately many times neglected in many public health programs. And the third component within that particular result level, the enabling environment, whether we're talking about a social or policy environment, and through which different strategies are tested, and public and private partnership is one of those strategies that many of us are testing towards attaining an increase in utilization of key practices, utilization of key health practices, whether we're talking about HIV, family planning, reproductive health, maternal and child health, including neonatal health, nutrition, etc. And the third and the highest level of result being at the impact level. What is it that, whether it's the public and private partnership model or performance-based financing or capacity building, brings into the delivery of those particular public health evidence-based interventions that we know save lives, vitamin A supplementation, expanded program of immunization, promotion of exclusive breastfeeding, etc. What is it that all of these strategies are trying to help us in delivering those interventions to the ones who need them the most, vulnerable and disadvantaged population groups, in order to increase utilization of services with a heavy focus on strengthening health systems for a behavior change of those who most need those interventions, and hopefully in the long term have a major impact, a positive impact in morbidity and mortality rates. So in this context, let me share briefly with you a particular experience that we are currently developing in Peru, based on a USAID-funded project at the community level called Healthy Communities and Municipalities that MSH has been implementing over the past 4 years. And one of the particular approaches of this project is to work at the community level, strengthening the capacities of community structures, community entities, and local governments in order to address local health, public health problems or issues for their own communities. And the project has been implemented quite successfully. There has been a rapid scale-up and uptake of the interventions that we have been using for strengthening these capacities of different communities and structures. Community development committees, for instance, is something that we have been able to develop and strengthen over 1,300 communities in mostly rural areas of Peru. And trying to work with the local governments, municipalities, to make sure that they are also strengthening their capacities on how to manage the limited resources that they receive from the central government of Peru, and trying to make pretty much the best bang out of the buck that they receive in order to improve the health of those communities, and particularly mothers and children. I'm bringing these particular details of this project because it is under this particular context that we were approached by the USAID mission in Peru, as well as the private sector in Peru, particularly some extracting companies there, who look at this particular approach, and they would like to invest heavily in this and trying to scale this up throughout most of the disadvantaged communities in Peru. So it is under this particular context that we are providing technical assistance to over 300 communities at the community level and at the local government level, mostly municipalities, working together with the mission, USAID mission in Peru, as well as with a mining company that is not only providing the funding, but also a great alignment and interest, a strategic interest for these three groups that are putting forward this public-private sector strategy. We have a number of strategies taken from the Healthy Communities and Municipalities project that we are bringing to this particular partnership. A lot of them includes capacity building to make sure that we are empowering those communities for some sustainable solutions, to make sure that they understand what their main public health issues are in their own communities. Making sure that they are aware of how to plan, how to strategize, how to do the scanning of their own issues, and to be able to prioritize and set aside resources together with the local governments in trying to address those particular issues. So we see this as a relatively low-cost solution, but a sustainable solution, simply because we are empowering those community leaders in areas where usually the health system, unfortunately, doesn't have the resources to get to those particular hard-to-reach communities in the highlands of Peru and in other areas of Peru as well. So this is something that is ongoing. We have results based on this approach of the Healthy Communities and Municipalities projects, in which we have been able to demonstrate positive results in areas of immunization for children under 1, in areas of skilled birth attendance, in areas of antenatal visits for those pregnant women, and also increasing the institutional births for these particular hard-to-reach populations. So it is this particular strategy that we are transferring to this public and private partnership that we're doing with a mining company and with USAID in Peru to address specifically maternal and child health and nutrition issues. They were also interested in addressing the chronic malnutrition, which unfortunately, if you take a look of the statistics of the country, it is a little bit misleading. Always in a developing world, we always see two different worlds. The one that you see in big cities, in big capitals, and then when you go into the other rural areas, the situation tends to be quite different. So this is not an exception in Peru, in which we can see chronic malnutrition up to 55, up to 60% in some of these rural areas that we're working on. So we have obviously many commonalities in terms of the lessons learned that we have heard so far from Wendy and from Joy and Hugh. I would like to point out 3 of them and then stop talking and hopefully entertaining a little bit more questions. The first one is to ensure that we have a common vision and goal to improve the utilization of health services. And I would like to underline the word utilization, because it is not just by increasing access to or availability of services that we should expect immediately those mothers or caretakers to fill those health facilities with their ill children. We need to work on quality of those services, both technical quality and perceived quality. Both are completely different, but very important if we want to increase the utilization of services. The second lesson is to ensure that we're building stronger systems through ensuring building local capacity and country ownership. We see a lot of discourse recently with the WHO health system strengthening of the 6 building blocks, whether we're talking about service delivery, health workforce, health management information system, leadership and governance, vaccines, technologies, etc. All of those are important and are mostly part of the supply piece of the health system. But we also need to make sure that the demand is included there in our strategies, in our approaches. And that's probably one of the successful elements of this particular project in Peru, because we are strengthening those capacities of community leaders and community members to make sure that they themselves understand what their issues are, and that they also demand the services, whether those services are delivered at the community level by a community health worker or at a health facility or at some point in these 2 entities. And third, and last but not least, to make sure that we have common interest in saving the lives of vulnerable and disadvantaged populations. Thank you.